The good news is that asthma is easy to control, and you have the ability to take charge, take control of asthma, and by doing so, your child will be able to do everything that a normal child can do.
There are two ways to control asthma. One is to control the environment, that is the asthma triggers for the child with asthma, and the other is to stay on a daily medicine regimen. Asthma triggers are things that make asthma flares occur.
The three basic groups of asthma triggers include cold viruses, allergy triggers that can be inside or outside the house, and irritants like cigarette smoke.
So if a child has dust as one of the things that triggers their asthma, or tobacco smoke, the way we control it is keeping them from that environment.
With their asthma doctor or clinician, they should identify the things that create inflammation in the patient's environment and home.
We took up the carpets in his bedroom. We got rid of all the fuzzy things around his room, and we usually clean his room with white vinegar and water.
If the child's symptoms continue after avoiding all the known asthma triggers, it's important to see your doctor about a daily medication. This daily medication is called controller medicine.
There are two types of asthma medicines, quick relief and controller medicines. Quick relief medicines such as albuterol relax tighten muscles in the airways during a flare. Quick relief medicines should be taken only as needed for asthma symptoms. If a child needs to take quick relief medicines regularly, it is a sign that the asthma is not under good control. Controller medicines, such as inhaled steroids, help reduce swelling, also known as inflammation, in the lung. Controller medicine should be taken every day to reduce symptoms and prevent flares.
You can't take your medication when you're just having symptoms. You know, I think you waited too late then.
It's very important that you take the medicines every day, whether the child has symptoms or not.
I don't take my medications every morning and every night. I can't really do my gymnastics as good. I get tired.
Patients should incorporate their daily steroid or controller medicines into their daily lives, just as they brush their teeth or change their clothes every day. That's the key to success in using these medicines.
The controller medicines are steroids. When parents hear that their children will be on steroids every day, they're concerned about several things.
Steroids at first, they did concern me because I guess it's a natural reaction. You hear steroids and it definitely, it alarms you.
The steroids that we use are natural products of your adrenal glands. They're a normal part of the chemicals that your body produces.
The most important concerns seem to be about growth.
However, there's a number of studies now that show that children with asthma who use inhaled steroids for many, many years develop and achieve the full growth potential that they would have achieved had they not gotten inhaled steroids.
Many people are concerned that taking medicines for their asthma will make them dependent on those medicines, or that if they use them regularly or every day, that they may not work as well.
But this really isn't the case. There are a number of studies that show that asthma medicines work better if you take them every day, and they don't lose their effectiveness over time.
I've seen my child very, very sick, and I realized that he needs these medications. And it's just like any other type of illness. If you have medication that can help your child, you have to give the medication.
Families need to know the facts about controller medicines. These medicines are safe and work through natural ways that the body heals swelling and inflammation. They use low doses delivered directly to the airways where asthma occurs. Controller medicines have been shown to prevent flares and emergency visits and reduce symptoms for children with asthma. In order to work best, controller medicines must be taken every day. Children receiving controller medicines do need to see a doctor regularly to make sure the dose and type of controller medicine are right for the child.
Well, if you ever end up in the emergency department, it's very important that after that experience, you make an appointment with your family doctor, go to the doctor, and get some kind of course of action, some type of plan in place.
The asthma management plan is a written way for you to know when to use your child's asthma medications.
If your child has not had an asthma management plan until now, it's time to make one with your doctor.
No one wants to keep going back and forth to the emergency room. That's no way to treat asthma. The best way to treat asthma is to take more of a proactive approach instead of a reactive approach. If you wait for the symptoms to occur, a lot of times you end up with your child being sick unnecessarily.
You don't want to go through that. You want to catch it soon.
The key is consistency, medication consistency.
Remember, there are several steps to controlling asthma. Since each child is different, it is important to make regular office visits to assess what the triggers of asthma are and how to avoid them. Many children with asthma need to take daily controller medicines, which are safe and effective when taken correctly. Every child with asthma should also have a written care plan that guides the family on what to do to treat asthma every day. You and your doctor should discuss the right way to control asthma for your child.